Hi everyone, welcome back to our Ask the Doc segment for our Facebook page here at the Parkinson Center of Oregon. I'm here with Dr. Matt Brodsky, and he's here to answer a couple questions. Okay, Dr. Brodsky, we have another question here for you, and this is a really good question. This person is wanting to know about possible symptoms that can occur in a person who has Parkinson's disease, other than the classic kind of first motor symptoms that show up, in which Parkinson's disease is typically diagnosed. And so kind of a two-part question, wanting to know what some of those symptoms might be prior to tremor and the classic symptoms of Parkinson's, as well as what kind of efforts are going on to improve diagnosing people earlier with Parkinson's disease.
So that's an excellent question for whoever it is that asked it. I think a very important one for Parkinson's researchers around the world to try to answer. In fact, if we're ever going to come up with a cure for Parkinson's, I think that part of that solution is going to be finding ways to detect Parkinson's disease in people before they actually have the obvious motor signs that we use today to make the diagnosis. The problem we're running into is that there are a number of non-motor features that may predate motor signs and symptoms. However, they are not 100% specific for Parkinson's disease. Some examples are loss of sense of smell or decreased sense of smell. This is a common early symptom in people who then go on to develop Parkinson's disease. However, not all people who develop this symptom go on to develop Parkinson's disease in their lifetime. But this symptom can predate the motor symptoms by many years. Another example is this syndrome known as REM sleep behavior disorder, where people do not have the normal paralysis of their muscles in their body when they're in the dream state of sleep, and may act out their dreams kicking and punching and screaming. And in fact, they have no symptoms of this. Their bed partner may report this in the clinic, but they don't. This is also a syndrome that can predate the onset of motor symptoms by many years, and again, not 100% specific to Parkinson's disease. A couple of other examples, also not 100% specific, include depression. Depression can predate motor symptoms, again, by a number of years. And a longitudinal study that in a group of aging folks in the Honolulu aging cohort have taught us that decreased bowel movements, constipation, may be an early risk factor for Parkinson's disease. Again, not specific for Parkinson's. So we're trying to come up with, in the field, with a test battery, if you will, and a way to screen people who may be at risk using some of these symptoms. In addition to these clinical symptoms and findings, there's a whole field and a whole effort going forward looking at so-called biomarkers in the blood, in the spinal fluid, and using advanced imaging techniques, again, to detect people who may be at risk of developing Parkinson's disease. And I mentioned at the beginning here that this is going to be critical in moving forward with more effective therapies and perhaps a cure one day. By the time people have the classic motor findings that we use to make a diagnosis, a good 2/3 or more of their cells that make dopamine in the brain are already not functioning correctly. And it could be that we're already intervening too late in these neuroprotective studies that are going on now, and that we have to find a way to intervene sooner than we presently can.
All right, well, thank you very much, Dr. Brodsky, and thank you to everyone for tuning into our Facebook page for our Ask the Doc segment. We'll be continuing to post questions, and as always, please post your own questions that you'd like us to answer, because we do check the page, and we will answer any questions posed by patients or just anybody else that wants to post a question. Also, we have a YouTube page for Parkinson Center of Oregon that will feature all of these videos together. So if you want to just check it directly on YouTube, you can do that. So thank you, everybody, and we'll see you soon.
Bye.